Does your loved one who's either homebound or bedbound have a wound on their foot from pressure, either involving the ankle or the heel? Well, I'm going to talk about it with you today and try to help you. I am Bienstock. I'm a board-certified plastic and reconstructive surgeon. I specialize in wound care in those that are homebound or bedbound that can't go to a doctor's office, wound care center, or a hospital. So let's talk about wounds from pressure on the feet. These are very common, just like pressure ulcers of the trunk, meaning the hips, the buttocks, or the sacrum, meaning near the butt. They're due to pressure, meaning that the patient is not being offloaded. We're not taking pressure off of the foot, which means that the foot, either the ankle, the heel, is resting on the bed or some other surface that's hard and is developing a wound. I see many of these due to the fact that they're not being offloaded, meaning there's not adequate cushioning on the feet, and or the feet are not being floated, which means they're kind of hanging in the air. So the most important thing in these type of wounds, before even getting to actual wound care supplies that we use, is making sure that part of the foot, whether it's the ankle or the heel, is not touching any surface. Well, how do you do this? So you can either put rolls underneath the calves, meaning you take a sheet, a towel, or a pillow and put it under the calves. So the feet are kind of free floating. You could also hang them off the bed. That becomes more challenging because most people can be lying uncomfortably in the bed if their feet are hanging off the bed. Another option is to get special heel protectors. Most of the heel protectors I see in patients are made of lamb's wool and are very warm and really don't take pressure. All they do is add moisture and heat, which can actually exacerbate the wound. What I generally recommend are these type of boots. The company I like is Prevalon. They make these special heel protectors where they're kind of a nice cushioning surface where there's actually a hole at the heel portion, and sometimes it comes a wedge so it takes pressure off of the ankle area. Once we have this in place, we can really focus on good wound care. Now, one of the problems when you're dealing with the feet, particularly heel, is surgical debridement versus not surgical debridement. A lot of times I see what's called the black scab, or what we call an eschar, which you generally don't want to debride, because once you debride that, you're going to be very close to bone, which has a high likelihood of being infected, leading to what's called osteomyelitis, meaning the bone's infected. This becomes very problematic. It becomes hard to heal, and the patient requires long-term antibiotics. So really try to do less surgical debridement on patients that have heel ulcers and or ankle ulcers. Now, there are times I've had to do surgical debridement when the wound's infected. It's already infected. And this means we have to get the clean tissue and get rid of all that gunk or slough as well as necrotic tissue. The wounds generally have to be changed on a daily basis. We want to maintain drainage. We use common products, whether they be an alginate dressing, mee salt, but the most important thing is minimize the bacterial load. We can clean these with things like Dakin solution, which is a diluted bleach, or Vash, which is hypochlorous acid. These things are kind of irrelevant unless you're really having strong pressure relief and offloading. Another important thing is that we always discuss in my videos nutrition. Protein and other vitamins are very important, such as zinc, selenium, and vitamin C. So all these things in conjunction can help your loved one heal. So once again, I just want to reiterate what I had said, is pressure relief for both the ankle and the heel, and make sure they're not touching any surfaces. A lot of the times we see this in the hospital because the patients are not being adequately repositioned. At home, there's really no excuse unless you don't have you have inadequate caregivers. Then either you, the family members, or you need to hire caregivers to really make sure that they're being turned. Just like for the trunk, whether it be the sacrum or the hips, once we've had adequate pressure relief, we need to really keep those wounds clean and change them on a daily basis if there's heavy drainage. If you have any questions or comments, please leave them below, and make sure you subscribe to the channel. I look forward to our next session. Thank you so much.